Baby, hello, nakupenda sana. Hello, mama, hello, wapi baby, mapenzi tamu. Hello, nakutaka sana. Oh, mama, oh, mama.
Asanteni sana, maze. Thank you for joining us for another epic episode of the Weekend Edition. I'm your host, Dr. Kingori. Kama vile mnajua maze, there's never been a dull week in Kenya, and we start with current affairs. This week, maze, the second lady, Mama Rachel Ruto, made headlines after she gave a testimony of having performed a miracle at their current home.
And when we drilled this borehole in 2003, when the water was taken, to be checked by the labs, they told us that we could not drink that water as it was until it was purified. I went to the kitchen, took a bowl, put salt, and went to the borehole. And I went and decreed the words of Elisha. I went and said, this water will never be dirty again. The water is now clean. Amen.
Manze. Yeye mwenyewe alisema aliongeza chumvi, kuna maheta wanasema in that spirit angeenda aombe Indian Ocean, freshwater lake. But then again, all that is non-consequential. I'm not in a position to argue with miracles, but my question is it a coincidence that as soon as the DP's wife announced that she had prayed for borehole water, ikatan fresh, the Machakos governor akaingia pande ya UDA? Now, if you are thinking what I'm thinking, then that was a genius move to get the Kamba vote. Now, some people have been shocked by the move ya Governor Mutua Kwanza kujoin Kenya Kwanza, especially after the much publicized painful handshake between him and the Deputy President a while back.
I greeted His Excellency Dr. Ruto and I extended my hand. Me, hello Your Excellency. Ruto, holding on to my hand. We jamaa umekuwa ukinichapa sana. Me, Your Excellency. Ruto, still holding on to my hand tightly. Wewe lazima sasa nikugonge. Nitakugonga. Me, Your Excellency. Sir, maybe we can speak about I started. Ruto pushing me aside. We ngoja utaona. Duale pointing at my chest. Si tulikuambia. Then they walked away.
Mazee alisema alimfinya mkono hiyo siku. The DP joked about it.
Nimesalimiana na jamaa mwingine hapo. Amenishika mkono. Karibu ikue kama ile ya Mutua.
But I knew Governor Mutua alisema ukweli, vile ali-explain, vile alifinywa, but you know what, as they say, it only hurts the first time. But then, back to the miracles, knowing the water problems watu wa inner corner areas za Umo hupitia, na vile utamani maji, I think it's safe to say that the miracle that Mama Rachel performed is a real azimio la umoja. But then again, you be the judge of whether the process of purification of water in this context is a miracle or a political science. Kitumisi sijui ni, with such a miracle to her credit, if the DP wins the presidency in the coming elections, Mama Rachel ataitwaje? First, ama the first lady. Now, in other news, watu wa Meru wamerepresent sana kwa news this week after the KWS responded to a distress call of a lion having been sighted in the area, only to find that it was a supermarket carrier bag. By the vile walikuja haraka, it was a great response by KWS, although critics were quick to note how slow KWS wanakuanga wakati wasimba ya ukweli, and Rongai people can attest to that. In fact, haters wanasema for the Meru case, KWS only showed up because they were chasing the bag. Now, and I love this explanation by one of the witnesses of how it went down.
Ukua pale uwezi ascertain si mnyama. Tulikuwa tunaona kabisa ni mnyama mpaka watu wa ONREF walipokuja. Kafika, wakaangalia. Hata wao walipokuja waliconfirm ni mnyama kweli wakiwa kwa hiyo distance. Lakini walipoingia kwa nyumba wakaangalia pale ni akasema, "Ai, sioni hiyo mnyama pande ya nyuma iko wapi, naona tu ni kama kichwa." wakaja finally wakafikia, wakaona mmoja alipofika karibu akaangalia akaona si mnyama.
So hata KWS walishtuliwa na kichwa tu. But then unataka kusema hata KWS hawangejua simba ni ya ukweli mpaka waangalie nyuma. The Kenya Wildlife Service, as in wale wako charge na wanyama, walienda kuangalia nyuma kwanza ndio wa confirm kama ni legit. Kwani KWS walituma fisi. Unajua, in other news, the Business Daily this week reported that 41 new helicopters have been registered in the country ahead of the elections, and what is the choppers belong to politicians. And this is a very interesting irony, buying helicopters to go promise people good roads. Or better yet, kununua ndege na kura ziko kwa ground. Also, Wiper leader Kalonzo Musyoka was on the spot this week after he changed his mind about attending the Azimio interviews to deputize Baba.
Kalonzo umekuwa running mate wa Raila 2013 na 2017. Interview gani unaenda kufanyiwa? Interview gani?
3 days later.
We didn't want to give anybody an excuse whatsoever to say aligomea kuja. So I'm here and I can tell you it has been a wonderful conversation.
I believe Kalonzo is the only politician in this country who can promise change. And he has a track record. Now, mtu akiuliza how many times has Kalonzo changed his mind, it's on record. By the way, we can profile Kenyan politicians by how they get to office. One, through change. For example, best example, we've said ni Kalonzo.
I would be the most stupid fellow on the earth to go and support the third time a presidential candidate.
Raila Amolo Odinga tosha.
Now, a leader can get to office through a calling. Best example is Machakos Governor Alfred Mutua.
Namalizia kwa kusema naona mheshimiwa ananipigia. Your Excellency, sir. I'm leaving now. Nimeitwa mkutano. That was Mheshimiwa Raila Odinga. Akiitana tunaenda. Ndamsalimia. I saw a missed call when I woke up this morning from Deputy President William Ruto. I haven't spoken to him. His people have been calling me for the last few weeks, including my good Senator Cherengai always urges me. He called me last night because he's seeing an opportunity. He's calling people. He's saying, come in. I haven't talked to him. I'll not talk to him until I talk to my people.
So you didn't pick his call?
No, I was asleep because I sleep early because of this show.
That analysis ndio ilifanya ni understand maze kuitwa, calling na hizo mambo zingine, or you can be a leader by being the chosen one. Now, one of the reasons Kalonzo gave for changing his mind about attending the Azimio interviews is that bishops were part of the interviewing panel. So why not go sit with the men of God?
So I'm here and I can tell you it has been a wonderful conversation. Wazee kama Bishop Njenga, Archbishop Zacharias Okoth, I looked at that in my own mind and I said, why would I not want to go and greet Archbishop Okoth at his age?
Well, it's safe to say that Kalonzo treats politics as a game of chess. He knows how important the bishop is to the king. Kuna watu wanasema pia ati labda Kalonzo alitaka kwenda kuona bishop jua kuongea kwa matanga ya Kibaki. Kila mtu ako na opinion yake. But we have a very interesting topic, a topic that affects each and every one of us one way or another, into universal healthcare. So we managed to get in studio the head of beneficiary management at NHIF, Mr. Wambugu Kariuki is in the house. Asante sana. Alafu, now that hii show ni yetu maze, niliuliza wadau pale Facebook, kila mtu arushe swali yako nayo about NHIF maze. One of the first questions was from one of the most active members kwa page yangu ya Facebook, anaitwa Korosa. Alikuwa anauliza kama mtu asipokuwa mgonjwa maisha yake yote, hiyo pesa yote inaendanga wapi? Mwingine nimeona pia anauliza kama unaweza enda lunch kwa hospitali na kadi yako ya NHIF. Hivyo maswali vile zimeulizwa. Hivyo tunaenda kuziuliza hivyo. On the real though, we intend to get as many answers to all your legit questions about NHIF and universal healthcare on the other end of this short commercial break. See you guys in a bit. Welcome back to the weekend edition. Mazee, I'm Dr. Kingori. Leo tunaongelea universal healthcare. Now we have in studio, and we are very happy to have him, the head of beneficiary management at NHIF, Mr. Wambugu Kariuki. Wapi makofi yake tafadhali? Asante. Asante sana, asante. Wase niliambia wasi karibu kwa show yetu mazee.
Oh, I welcome you.
Yes, asante.
Thank you.
Karibu.
Thank you so much, Dr. Kingori.
Asante.
I'm so glad to be here and to have this discussion on universal health coverage.
Yes.
And NHIF, and to know how NHIF is driving the universal health coverage in the country.
Okay.
So I'm so delighted to be here to have this discussion.
We're also happy to have you.
Yeah.
Now, when I asked people, now itanga wadau pale Facebook, to forward questions, any question you've heard about NHIF, and I saw someone ask kama unaweza enda lunch kwa hospitali na kadi yako ya NHIF. Nikajiambia, manzi, sasa watu wako aje. But then, my team tukikaa chini, we convinced each other that it was a valid question because ukienda uambie daktari unakufa njaa. Si anafaa kushughulikie. So I believe it's proper to respond to that pamoja na swali ya kama mtu anaitwa Love City. It's a lady. Anza kama mtu anaweza tumia NHIF kulipa rent. Juu kilala nje pia baridi inaweza kuua. So
yeah, thank you so much, Dr. Kingori, and actually the listeners and the viewers who have had that question,
yes,
or those questions.
Yes.
One, I think it is important to understand what NHIF stands for. NHIF stands for National Health Insurance Fund.
Okay.
So it is a health insurance fund that is supposed to take care of you for your health needs. That means when we are seeking healthcare services, that is now when it is supposed to cater for you. Actually, to put it right, is when you are seeking treatment. Actually, before 10th of January this year,
yes,
NHIF used to be called National Hospital Insurance Fund,
yes,
until the amendment of the NHIF Act, which now transformed the names from National Hospital Insurance Fund to National Health Insurance Fund. Now, before it was being called National Hospital because it could only cater for you in case you are admitted in hospital. Okay. Now it is National Health Insurance Fund because it is catering for more than just admissions in hospital. It is also catering for services you actually don't need to go and for admission to hospital, or even where you don't need to go to a hospital, you can go to other services like MRI, CT scan, which not necessarily you don't take in hospital. So it will only cater for you for health needs, and it covers 10 benefits, and given a chance I'll still be able to explain the 10 benefits. 10 benefits that it actually covers. But of course there is
so
no rent.
Make sure you fall sick within the 10 benefits.
Actually the 10 benefits are like what a Kenyan needs, or what a human being needs for their healthcare needs. But of course those 10 benefits do not include rent or lunch. Actually there's also another one who asks whether you can go to a barber kwa kinyozi na salon.
Yes,
na NHIF card. So that one is yet to be covered. Yeah.
Sawa. You'll explain to us ISO 10 benefits so that
yes,
we can break them down.
Yeah.
And then someone called Lena aliuliza a very valid question. Anasema outpatient option should be scrapped because if I get sick in Kariuki and my outpatient facility is in Kakuma, why can't I get treated where I am? Ama just to respond, inaweza kuwa ni NHIF wants you to do exercise kidogo, waone si kuchoka umechoka, unahitaji tizi.
Yeah, thank you for that question. And that question is in regard to the outpatient benefit. Yeah. Because as I said, we have 10 benefits. Now, the outpatient benefit, we give it through a method of payment we call capitation. That requires you to have selected a hospital where you frequent for your outpatient services, and that is where you'll be going for your healthcare needs. However, there's a provision, and actually that is a provision even in the Ministry of Health. In case of emergency treatment, you can actually be treated anywhere where you are. And actually the government there's also already a law that is being worked on, which now will make giving of emergency health care compulsory across the country, such that if you are saying your facility is in Kakuma, but you have visited Kariuki and you need emergency treatment there, then you can be given there with a duly registered hospital in Kenya under the emergency care provision. Okay. So that one is already provided for, and it is even being strengthened by being made actually into a law that is already in the process.
Sawa. So umesema it was provided under capitation.
Yeah, it is a method of court capitation. What that requires is that you have to select a hospital beforehand, because we have to pay that hospital in advance to give you the treatment that you require. It's almost a similar method of payment like what the government uses to pay for secondary school and primary school. Okay. They know how many students are in the school, they pay the school that money. Okay. So in the same case, somebody will choose a hospital. Let's say you have chosen Bagathi Hospital, just to give an example. It has been chosen by 1,000 people, so Bagathi is going to be allocated money for 1,000 people to give them all the treatment they require for the period that has been agreed.
Thank you. Hiyo make sense sana. Unajua, I needed to get the definition of capitation. Decapitation ndio kukatwa kichwa. Thank you. Alafu, do you have, kuna Omondi Mose anauliza, Omondi Mose Jaboro Nango anauliza, do you have a portal where one can update status without visiting your offices?
You can actually register with the NHIF online. You can register, you can go online to our website, and you'll be able to see the place you can be able to register online. What you need is only to have a colored passport photo in soft copy, and also a copy of your ID. Now, that is now in terms of registration. However, when it comes to updating status, for example, like adding your spouse, adding the children, that one would require the submission of documents to an NHIF office or a Huduma center for the purposes of the authentication. We want to know that Dr. Kingori is bringing this lady to say this is my wife, is actually Kingori's wife. Dr. Kingori is bringing, because you have to produce evidence to show that you are married to this person. Dr. Kingori is bringing a document to say this is my child, so we need you to produce a birth certificate to confirm that actually this is your child. If that process was to be done online, then, and this is because some of the government processes are not yet automated. Yes. Because why we allow you to register online is because when you are registering online, we have already linked with the registrar of persons, whereby the system is able to confirm that the person who has registered indicating his name as Dr. Kingori, for this ID number, those are the names in the Integrated Population Registration Services System that is able to confirm that. That system is not available for the registration or for the birth certificates, and also for the marriages. Once that one is in place, actually Kenyans will be able to do all those processes online. You can be able to update your spouse online, your children online, because the system you'll be able to counter check. Yes.
You'll be able to update your spouse online.
Yes. You can go and say, this is my wife. The system will check with the registrar of marriages and see, yes, this lady is married to Dr. Kingoli.
You can't just check my Instagram and...
We may find several.
Alafu, there's also a complaint that NHIF gives a preferential treatment to civil servants. Like where ukienda kwa hospitali and yes, they are registered NHIF service provider, watakuuliza kama if you are a civil servant. If you're not a civil servant, mostly they only pay for your bed peke yake. Si hata afadhali wakupee dawa ukunywe ulale kwako.
Okay, thank you, Dr. Kingori, and the viewer who is asking that question. Now, let me first of all explain that at the NHIF, there are two major categories of schemes. Mm-hmm. We have what we call the National Health Scheme. That is a scheme that is for everybody. Every Kenyan who is contributing to NHIF, the 500 shillings per month, or even that one who is being deducted from their salary at the end of every month, they are a member of the NHIF scheme we call the National Health Scheme. It is a scheme for everybody. It is the social health insurance scheme. Yes. However, there are those ones who want an extra scheme, and a scheme with more benefits. Yes. Now, there's a provision, and many employers would want to have their employees have a more enhanced scheme that can be able to cover far much more than what NHIF covers. Yes. Because NHIF is limited because, again, you give an insurance cover depending on the premiums you're collecting. So the premiums that NHIF is collecting are able to give benefits up to some extent. Now, some employers say, I want my employees to have far much more. Hata akienda hospitali, akai private room, mahali yako na TV, mahali anapewa menu like a hotel. So there are some employers who want such treatment. So they get an extra cover for the employees. Now, for the government, they decided that to get that extra cover, instead of going to the private health insurers, they want to purchase an extra cover for the employees from NHIF. So they pay for those civil servants extra premiums to NHIF, besides the anakatwa. Wanamlipia ingine zaidi, and so that money which could have been paid to a private health insurance is now paid to NHIF to give the civil servants an extra cover. So it means it's not that the civil servants are given preferential treatment, but actually civil servants and even the police are paying far much more than what the ordinary Kenyan is paying.
Which begs the question of, yes, a private citizen wa kawaida, can they opt for the special cover from NHIF and not another health insurance service provider?
Okay, it is also important to appreciate, thank you Dr. Kingori and the VIA for such a question. It is also important to appreciate that in this country, there are also private health insurances. Yes. Now, that business has to, that provision has to be such that besides NHIF taking the whole business, there should be a level playing ground such that even those private health insurances should be able to share the same market. It is on that provision that now the government has advised the NHIF that to ensure that the other private insurances also have a market. Okay. Let NHIF restrict itself to give extra covers to the public sector, and then leave the private sector for the private insurances to also be able to do that. Because if we are to take all the business, because NHIF is definitely cheaper, everybody will come to NHIF, then all the other private insurances are going to do what? They are going to die. Okay. So that one has been left for the private insurances to do that business for the private Kenyans. NHIF is only allowed to give extra covers to public officers.
Okay, so if you are interested in special cover, join the police. And then, we have kuna madam hapa anaitwa Mwacharo Eunice. Yes. She says that if you can refund her contribution from 2013, so that she can start afresh. She has not fallen sick from 2013. Ndio mwanze on a clean slate. Like you can rub the rice, hiyo ya kitambo, you mwanze tena.
Thank you, Eunice. Actually, many Kenyans, when we were starting, we were talking of a Kenyan who is saying, they have not fallen sick, and actually many times Kenyans, can I be given that money as a retirement benefit or something, I will invest in another area. But the important thing to appreciate is this. Like, let's give an example to a Kenyan who is contributing 500 shillings per month. How much is that per year? 6,000 Kenya shillings. Yes. Now, 6,000 Kenya shillings is the money you are giving for an insurance cover for your family. By then, this is a family cover. It covers you, your spouse, and your children, regardless of how many children you have. Now, let me give...
Covers you for how much?
That's another example I want to give. Okay. Now, I said we have 10 benefits. Maybe I can mention those 10 benefits very fast. Yes. One of the benefits it covers is outpatient. Then it also covers inpatient. But let me give an example to a benefit like renal dialysis. Now, renal dialysis is a benefit that is given to a patient or somebody whose kidneys have failed, and they have to go through an artificial process of cleaning the blood, the process we call dialysis. Now, for dialysis, NHIF pays for you 9,000 shillings, 9,500 shillings per session. And you are required to go for at least 2 sessions per week. Now, if you multiply that with 52 weeks, NHIF actually pays for you 988,000 per year. So it's a Kenyan who has paid 6,000 shillings. They have enjoyed a benefit of about almost $1 million. So the question would ask yourself, where is the money to pay $1 million for somebody who paid only 6,000 shillings? It is coming from Eunice, Dr. Kingori, and somebody else who is not sick at the time this person doing dialysis requires treatment. Yes. And together with that, this person who is undergoing dialysis may also require to go for an MRI, may require to go for a surgery and actually if somebody was to go for a kidney transplant, we'll also pay for you up to $500,000 to do that transplant. So you can see that as much as Kenyans are contributing little for long, when they need to benefit, they benefit in a big way. So it means this money is going to a pool, and somebody who needs benefit at one particular point benefits when the others are not sick. So Eunice's money may not be lying somewhere in a separatory. It is actually benefiting that person who is requiring dialysis, who is requiring a surgery, who is requiring a transplant, who is requiring even chemotherapy and radiotherapy for cancer treatment, because these are all benefits that are covered by NHIF.
Okay.
Yeah, under the UAC program.
A kidney transplant, $500,000?
Yes, we'll pay for you $500,000.
For the transplant?
Yes, for the transplant.
How much for the kidney?
No, see, that is the process. It is a process, you know, the transplant is the process of getting the kidney from one person and putting it into another person. So that process is covered. Of course, the kidney is never sold. It is you, Dr. Kingori, donating his kidney to somebody else.
Ajui? It's... sorry. I think you're not updated on the market. Francis Kibe is very angry about the dental cover. Anasema it only covers tooth extraction and filling. Anything else, they call it cosmetic. Madoido. What do you have to say to
Thank you, Kibe. Dental...
That's a very rare statement.
Yeah,
dental. Kibe.
Yeah, okay. Yeah, the gentleman who has the question, I think is called Kibe.
So just thank you and Kibe do not go in the same sentence. But
so dental. Okay, for the national scheme is true. It will cover the extraction and the filling as he mentioned. However, UHCR, we have just talked about the universal health coverage. Universal health coverage is actually expanding the coverage because I mentioned that the NHIF Act has been amended. Now, one of the amendments that have been done is that it is making NHIF mandatory for every Kenyan. Right now, there are Kenyans who are not members of NHIF. And because there are some people whom it is voluntary for them to join. But now the new act that was assented by the president on the 10th of January this year makes NHIF mandatory for all Kenyans to enroll. Now, when the basket of contributions becomes big, the benefits becomes more. However, even then, when it comes to treatment, it is even like there are, besides even some of the cosmetic processes of the teeth, there are also cosmetic surgeries that people do. It cannot be covered by any insurance. Why? You are not doing it because they need to do it. You are doing it because maybe you want to look better, more beautiful, more handsome. However, any dental procedure that the doctor prescribes as a necessity for the purposes of treatment, once that cover is expanded to cover all those other things like what we call tooth scaling, the root canals and all those other processes, and it becomes part of the package. They are going to be covered once it is a prescription from a dentist that you need to do them as part of treatment. But anything cosmetic, you simply want to align your teeth well, is not a medical necessity or dental necessity, then that one may not be covered.
So the government is not interested in people looking good. Now I know why. Tunakaanga vile tunakaa kwa picha ya ID. Many thanks to our guest, Mr. Wambugu Kariuki. Wapi makofi yake? The head asante sana director wetu Mikey na kila mtu ako behind the scenes, Coach Tom, Daktari, asanteni sana. That's it for the weekend edition. See you next week. My name is Dr. Kingori.